We need your help to shape the future of health and social care in Kent and Medway. We want to improve care and keep people healthier for longer, but we're facing new challenges that mean we need to change the way we work if we're going to do that with the money we have available. We're living longer, and that's good news, but we have different health and care needs than we used to. More of us are living with long-term conditions such as diabetes and dementia, which means we need more services. But the types of services are not the same as we needed in the past. We know things can be better, and the people of Kent and Medway deserve them to be better. The good news is that we can make real improvements in health and social care. We know that we could provide more services in local communities, more cost effectively and more conveniently for local people. We want to reshape services to suit the needs of individuals, helping people to stay well, to stay independent in their own homes, and to avoid going into hospital if they don't need to. There is lots of good work already happening that we can build on.
Through Encompass, we work as groups of GP practices. This enables us to develop and provide services that we couldn't do as individual GP practices on our own, increasing the range of services in the community to our patients, preventing patients having to go to hospital for treatments they would previously have needed to attend hospitals for. It's GPs with other health and social care providers. For example, it's GPs with the Community Health Trust who provide district nursing and also voluntary sector agencies. We now have a community geriatrician working with us. This has been very valuable. There was a frail elderly lady I was called to recently who had had several strokes at home and had started fitting. Previously, I would have advised the family to call an ambulance and she would have been taken into hospital. On this occasion, I was able to go and visit her, immediately contact a community geriatrician and get support and advice to start medication that I wouldn't have previously started on my own as a lone working GP. We were able to provide increased support to the family in the home and prevent the lady going into hospital.
Pain First is a service where we try and incorporate our health and social care services under one umbrella, and it's about getting patients home and then completing the assessments within their own environment, which makes it a lot better to establish the correct equipment needs and the right social care package that the patients require.
For 2 months and 4 or 5 days I was in hospital in bed permanently, and I missed my family so much. I just wanted to be at home. Kim and her team took over and they've worked wonders with me. I've even done the stairs now and can manage to get to the top. They've been a wonderful team. I've had constant care, and like I've said, if I'd have been royalty, I couldn't have been treated any better.
Patients prefer being at home, and research has shown that patients recover better and quicker in their own environment around familiar faces.
Mum was in hospital such a long time. When she came home, obviously she was very nervous, we all was, didn't know what to expect. But with an hour and a half of being home, the bed turned up, it was put up, and it was like a switch in Mum. You could see the difference, and she was more relaxed. And then the aftercare came in within 2 hours. It all fell in place, and we haven't looked back since. It's been great.
It's just wonderful to be with the family and that.
So Open Dialogue is about seeing not just the individual but the family and their social network One of the key aspects of it is the window of opportunity that we call at the very beginning of an episode of crisis. What we try to do is go in quickly, intervene quickly at that point, but then importantly the same clinicians remain part of someone's care throughout their care into recovery. So it benefits service users because the evidence has shown that it seeks to reduce hospital admissions. It seeks to reduce the rate of relapse into crisis, and also it seeks to reduce medication usage. But encouragingly, there are also other benefits, such as people returning to work or employment much quicker. We're trying to build resilience for people to stay well longer and manage their own mental health.
The 3 West Kent District Councils offer a number of activities to help people to keep fit and healthy and to socialise. This chair yoga today is just one example of those. And what's really good about them is it helps to strengthen their core muscles, helps to prevent trips and slips, but also enables them to socialise. So it helps to defeat loneliness and mental ill health conditions. Due to increased demand on the NHS, councils are now stepping up to the plate, and we're using all our tools and services together in a holistic way, housing, planning, environmental health and so on, to keep people healthy for longer and to promote well-being. This will decrease demand on the NHS and on GPs, which will end up saving money, but more importantly, it enables people to live much better quality of lives for longer. And we're also working with GPs so that they can refer people to services such as chair yoga. So it's a genuine partnership between local government and the NHS to keep our population as healthy as we possibly can.
Our ambition is to improve the health and well-being of local people with joined-up health and social care. Doing this means we can better meet people's needs within the funding we have available, building services that are sustainable for years to come. Doing things differently isn't always easy. It means staff working differently and people using services in new ways. We'll have more day-to-day services available closer to home, easier to access when they're needed. And our hospital services will be better for those people who need specialist care. But we can't make the improvements we want to specialist services and still have them everywhere we have them now. So there will have to be some difficult decisions.
Our desire to make services better and the challenges we face at the same time mean things cannot stay the same way as they are. Things must get better.
We want you to get involved to help us shape the future of health and social care. There'll be lots of ways to influence what happens next, including surveys and public events.
You can also join your local patient participation group or health network to stay involved.